Final. We will talk on stem cell technology.
Thank you for inviting me in this forum, and I appreciate the introduction already given by Dr. Faundo, a fellow Ilonggo. We are setting up operations, by the way, in Iloilo, where there is a very active interest. Could I have the first slide? The invitation, I'm based in Europe and in the US, and I received the invitation through Dr. Alran Bengzon, the president of Medical City, who apologizes for not being here today. So a lot of the work I'm going to talk about involves the setup of the science programs applied to medicine in the medical city and not just on stem cells. I think too much attention is being paid to stem cells, where by itself it does not work. It has to be incorporated as part of a general medical program that takes into account everything about the patient. Sorry. I am going to start with a summary. There are recent advances in molecular biology. This is where it comes from, not really from the world of medicine. It came from the basic sciences in chemistry, biochemistry, molecular genetics, biophysics, biomedical engineering, where basic scientists for many years have already been studying the structure and function of cells. So basic biologists already knew from many, many years ago the power of stem cells, way before physicians even heard of them. And this is an important lesson for us because a lot of the attention is being paid to physicians and hospitals and not enough to our basic scientists, some of them actually here in the audience. But the capacity of these bioengineered living cells in culture are very powerful, and they are very different from the drug approach. Speaking as a chemist, I am scared of drugs. It frightens me. And they are simplistic approaches to human medicine because they usually do not address the root of the problem. They just mask the symptoms. And if there are problems in the field of stem cells, you can't imagine the scandals in the pharmaceutical industry, where recently major pharmaceutical companies were fined by the US federal courts billions of dollars, not hundreds of millions, but billions of dollars for false advertising and withholding adverse reaction information. So compared to the chemical industry, I would rather be in this field. Well, I am involved in both, being a consultant for many of these pharmaceutical companies as a lawyer, not as a doctor. But the technology goes beyond stem cells. It has to be integrative. And personalized medicine means that when we analyze patients at the molecular level, no two patients are ever the same. No two breast cancers are ever the same. And no two patients with type 2 diabetes or type 1 diabetes, for that matter, are ever the same. How can you treat them with decahon na standards and guidelines, putting people into boxes where they do not belong? This is the mass-produced, one-size-fits-all of the drug and pharmaceutical industry. Bioregenerative medicine is ethical and safe if it is done properly. You need major medical centers and universities with basic science departments in chemistry, molecular biology, physics, and engineering. How you can do this in a clinic in Mandaluyong or in a facility on the second floor of a McDonald's in Makati, I have no idea. And even worse, how you can set this up in a mall, it just boggles the imagination. FDA, how many people here are from FDA? Okay, no wonder I was in Europe and I got calls from Dr. Ona kind of getting alarmed about this because he reads the newspapers and sees these advertisings and, just frightening. Okay. But when done properly, this is a field that there is a competitive advantage found in the Philippines. And I will describe to you why being based in the US and being based in Europe, why I keep coming back here to teach and develop technology programs that did not start just 10 years ago, but it started many, many years ago, because I have, with personal experience, developed a confidence of the talent we have here in the Philippines among our health workers and among our scientific professionals. Okay. There is a tremendous amount of talent here in the Philippines. Ang daming matalino, but their talents are being squandered. Okay. And I'll look into the factors of in what ways they are being squandered. One of them is that we are not realizing their potential if we keep focused on the importation mentality and looking to the United States for drugs. Okay. Then we squander our talents. This is the Institute for Personalized Molecular Medicine at the Medical City, where this is one of the institutions I work with here. It is not a stem cell institute. Okay. Yes, it uses stem cells, but stem cells by themselves do not work. You have to put it in the entire context of approaching a patient at the personalized and the molecular level. This institute and its laboratory was recently inspected, scrutinized by the Joint Commission International, where they looked at the laboratory and scrutinized the infrastructure, the biosafety, the sterile procedures, the records on infection control, sampling handling, including the barcoding of the samples, and the clinical section was reviewed for its bioethics, institutional review, management, informed consent, patient protection, legal issues, independent confirmation of informed consent, data collection, and biostatistics, and got a score of 10 out of 10, which I do not see in our institutions in the US, with the overall score for the Medical City of 9.88, which is much higher than my institution in Beverly Hills, Cedars-Sinai. Okay, the highest score we ever got was 9.5. Okay, but the overall score was 9.88 with a perfect score for the laboratories, including the stem cell laboratories. Okay. So, if you are going to operate here in the country, look into, of course, international standards, but we do not just follow international standards, we exceed international standards. These are some of the collaborators. I am just going to go through them quickly. This is not a complete list, so if those of you here in the audience whose names I did not mention, my apologies, but I had limited space here. But led by Dr. Bengzon in the Medical City, I'm going to say a few more words about what he has done in this area, because back in 1986, he already pushed for research in looking at progenitor cells. That's what we called them at that time. They are the same as stem cells, but these programs were already going on in the specialty institutes of the Department of Health. and collaborations with Ateneo School of Medicine and Public Health, the Ateneo School of Science and Engineering, who are actually now located within Medical City, where we train a lot of the chemists and molecular biologists and biomedical engineers. The National Kidney and Transplantation Institute, where we set up the first progenitor cell laboratory way back. And part of that group who led the applications of these stem cells was Secretary Enrique Ona at that time at NKTI, and Eileen Javier. Tess Barzaga of the Lung Center, who trained with us in Boston and in St. Luke's Hospital, in the UST Department of Pharmacy and the UST Thomas Aquinas Research Center, and formerly also in the College of Science, Dr. Gloria Bernas got her PhD in chemistry under me at Harvard, who was the Dean of the College of Science of UST, who set up the first live cancer cell bank here in the Philippines. Unfortunately, the bank died when she died, and it's now just being revived with the leadership of Myla Santiago and Cristina Binag, PhD in nanotechnology in chemistry. We have the collaborators from various institutions, including those of the UST, Centro Escolar University. We have graduates of FEU, Ateneo de Davao, who are participating with us, including our organization in California and also in Europe. I'm going to talk a bit about some of the legal issues, which is where I am based in Austria in the Center for International Law. I am a member of the European Union Lawyers Association, where we discuss regulations and litigation in the stem cell area, and I'm going to just briefly talk about them. And also, just to emphasize that in the ASEAN region, we meet with members of the Supreme Court of all of the ASEAN countries. I just had a meeting with the Philippine Supreme Court 2 days ago, and we met with the Supreme Courts of Indonesia, Malaysia, Brunei, and Thailand. And in 2015, we are hosting here, and I'm part of the hosting committee, to talk about food and drug regulations in the ASEAN region. We don't want to just harmonize because there are a lot of disputes in this area, and they will be going to the Supreme Courts of the individual countries. So this is kind of a complicated issue because it's no longer about health and science. It has to do with law and economics and politics. Let's take a look at the background of how eventually we wound up having an Institute of Personalized Molecular Medicine. This is not new to us and not new to the Philippines. I started my work here in the Philippines back in 1976 under the United States Information Agency and under United Nations. First, I had really had nothing to do with the Philippines because I was not really educated here. Okay. Even in my elementary school, I went to school in Bangkok, in Thailand, and then later on in Vientiane, Laos, and then later on in Europe. But you know, I kept coming back here to the Philippines because of my confidence that science is an area that the Philippines cannot afford not to invest. So even though I was doing technology transfer to various countries, including in Europe, to Germany, many of those German scientists were our students, and later on to Japan and South Korea. It was a very aggressive Jesuit by the name of Father Nebres, who at that time was not president of Ateneo, who reminded me in a United Nations meeting that I ought to be doing technology transfer to the Philippines. Why am I doing technology transfer to Germany, Japan, and South Korea? Okay. And it's been downhill ever since, okay, because the work is very involved. And we were teaching already back in the 1970s in UP Diliman, where I taught gene cloning there, to the faculty, and to Ateneo in the areas of chemistry and biotechnology. And then back in 1981, we had a consortium of Harvard and MIT, of people who were getting their MDs at Harvard and their PhDs at MIT, and I brought them here to the Philippines to do transfer and training under the US State Department, where we were teaching from Harvard cell and molecular biology, including progenitor cells, here in the Philippines, and working with scientists from UP, Ateneo, and UST. And then in 1983, under the Philippine Department of Foreign Affairs, we started the Science and Technology Advisory Council based in New York and in Washington, D.C., working with the DOST in industrial biotechnology. 1986, under Dr. Alran Bengzon in the Philippine Department of Health, I was a consultant under United Nations for Technology Transfer, and we set up the Advanced Medical Biotechnology Action Program, or AMBAP, where we trained people from NKTI, Lung Center, Heart Center, RITM, including what we called at that time BFAD in pharmacokinetics, but those from Lung Center in particular, NKTI and Heart Center, we already trained them in stem cell technologies. And we set up a live cell laboratory at the Lung Center, with the first in Asia to grow live human lung cells for lung regeneration, which unfortunately burned and was set up only recently under Dr. Tess Barzaga. Okay, so this is a major investment already put in by the Philippine government in infrastructure and in personnel, but primarily funded by United Nations, the United States Information Agency, and the World Bank. This is under Dr. Bengzon and Dr. Saldivar in the Lung Center, and then initially Dr. Alano at NKTI, later on under Ike Ona, and more recently under Eileen Javier. So the Department of Health has been involved in stem cell technologies for many, many years. Okay. The research involved in it, in looking at the basic science foundation, safety, and looking at its potential clinical applications, has been going on in the Philippines for a very, very long time. Okay. More recently, we have an organization called the Global Filipino Diaspora. We met in Rome recently, and I'm representing Eastern Europe, based in Prague. And then we met in Los Angeles, and there is going to be a meeting in February here in Manila. Basically, this is an organization of Filipino leaders all over the world. That's why we met most recently in Rome. And we looked at the Committee on Health and Science, and looking at overseas workers involved in health and science. And to my shock, when we developed these databases, that we have biochemists, graduates of UST and UP, working as maids in Paris. And we have people who graduated, even MDs at the top institutions here, at mga board top-notchers who are doing phlebotomy in various countries, not just in the US. I know some of them at UCLA. Okay. What is wrong with this picture? So on the one hand, we have such tremendous talent, and I know from personal experience what they can do, but they wind up leaving the country, accepting jobs that have nothing to do with it. I have nothing against being a maid. Okay. This is what I said, in Rome. There were a number of people in the audience who felt insulted, but, not when you are a biochemistry graduate from UP. So, in being involved in the programs here in the Philippines, and, stem cells, that is just, part of the issue. I mean, that's not the focus, but I'll talk about it anyway. Okay. What are our thrusts and guiding principles? We need to bring out the talents of Filipino scientists in health into application, not just classroom exercises. And I am so dismayed at all of the attention being done to meta-analysis of foreign published data. understanding that the data you gather from the published journals in the United States about prostate cancer from white patients do not apply to Filipinos? And the genetic profiles in breast cancer in the US, including BRCA, is not the same as Filipinos. And the strategy for approaching multiple sclerosis and systemic lupus, when we are looking at it at the molecular level, the Filipinos are not the same. Are you surprised? So you have to gather local data. You cannot rely on this meta-analysis of the American Journal of Cardiology. Okay. And I am so dismayed again to see all of the professors and the people who they train who are memorizing and quoting all of these American journals, speaking as an American. We need to provide local jobs, not brain drain. We need to have innovation, not imitation. Okay? This is just like, the other, more versions of singers in another rendition of Celine Dion. I mean, every time I hear this, I think that's a waste of talent. Okay. And I am attacking people like Charisse and Sasa Padilla in this case. I do listen to these things. Okay. Waste of talent. Okay. But even worse are our doctors and scientists imitating Americans. Okay. And quoting all of the standards and guidelines. And I'm going to attack the International Society of Stem Cell Researchers for promoting embryonic stem cells. We need local industries, not only importation. We need personalization, not the one-size-fits-all. We need customization, not mass production. We need to respect patient rights and autonomy, not just being paternalistic. We need enabling information, not just dictatorial. And let me tell you about some of the experiences of the US FDA. Okay. You cannot simply ban procedures or products in a situation where patients are ignoring the FDA and traveling abroad when they feel that it is their life at stake. You have to provide the ethical and safe alternatives here if you want to be able to bypass the unethical, unsafe practices. You have to put forward what you have to offer instead. Banning it will not stop the practice because patients are just going to travel abroad, which they are already doing. What I mean are Filipinos, not just Americans. Okay. Of course, the US FDA is realizing this now, so they had set up a bigger category of what they call, and what the International Society of Cell Therapists call, innovative practice, where it is not necessarily in the context of a randomized clinical trial, which is difficult to do in cell therapy anyway, but if it is considered in the physician's judgment to potentially alleviate suffering even without any guarantee of any such cure, that it would be allowed under FDA guidelines. But the data has to be gathered, including adverse effects. Okay, so the issue of regulation and its legality is not as simple as saying, oh, we are going to prohibit such practices. Okay, because what you will do, in fact, is just drive people away. We have to be a lot more sophisticated. Let's take a look at molecular medicine and stem cells. When I am asked, well, are stem cells safe? Do they have a role in human medicine? Well, just like drugs, it depends, right? It depends upon what type of stem cells. Their safety and efficacy is not about all stem cells as if it was a generic brand. It depends upon what type, how it is processed, how they are used, just like with any treatment. That's only common sense. Okay? But it is not a cure-all and not appropriate in a general setting, not even in a general medical center, because you need specialized technology, not just the equipment. You know, the equipment is dumb. Okay? It's the technology in the brain of the technologist. It's easy to collect. It's easy to inject. What is very difficult is how to address it to the specific need of the patient, and it's very difficult to process. It's really, speaking with 40 years of experience working with stem cells, it is very difficult. That's why it is fraught with a lot of pitfalls about data from Baylor University. Does it apply to the procedures we do here in Manila? And what type of stem cells? Dr. Faundo already described the experience with umbilical cord. The safety of umbilical cord is quite well established. Okay? The safety of compatible human donor, including bone marrow, is well established. But embryonic, aborted fetus, genetically altered, or animal cells, very dangerous. And there is indeed a move by commercial companies and even investigators in universities and some international associations to lump all of these together, okay, to create a smoke screen to ride upon the uses of legitimate stem cells like adult stem cells from bone marrow or umbilical cord, and then to ride by pushing their efforts in embryonic, aborted fetus, genetically altered, and even animal stem cells. Let me just backtrack a little bit about embryonic and even induced pluripotent or genetically altered stem cells. If there is a lot of information about the safety and efficacy of autologous, compatible allogeneic, bone marrow and umbilical cord stem cells, why is there such a big brouhaha about embryonic and genetically altered? The issue is legal. It has to do with patents and monopolistic practices to make profit. How can you patent a patient's umbilical cord stem cells? How can anyone in the United States prevent me from using my own cells for my own treatment? What is there for America to gain by you using your own cells and developing the technology here in the Philippines? What does Germany have to profit from you if they cannot export something to you? Okay. So the big drive for using these other types of stem cells, even though the same people intellectually know that there are legitimate sources of stem cells, has to do with law, economics, and politics, not health or medicine. Okay. That's why do not be naive. Okay? We have to be street smart about this, because these are factors that will affect us. Unlike drugs, they are difficult to standardize because are you surprised that living cells have a personality? Each of us do. Okay. And circumstances where you might consider this are conditions for which there are no known effective standard of care. What is the standard of care for retinitis pigmentosa? These patients are going to go blind. It's not as if there were no adequate studies. There are a lot of studies and nothing works. What is the standard of care for amyotrophic lateral sclerosis? Patients will die, paralyzed. What is the standard of care? Nothing works. Okay. And patients who are refractory to known standard of care. What do you do with patients with breast cancer who are resistant to chemotherapy? And the ethical considerations is a balancing of informed consent, yes, but you have to respect patient autonomy. When I was diagnosed with advanced cancer myself 11 years ago in the US, I received stem cell treatment, processed at Harvard and Dartmouth University. And they wanted, my doctors at UCL, they wanted to enroll me in a clinical trial that was sponsored by the National Institutes of Health. Randomized to placebo? I've been doing a lot of clinical trials in the US. When it came to me, I would not participate because I wanted to save dear old life. Okay. You can understand why patients are not they're not acting in a desperate manner. They are just doing what makes sense, right? Okay. And the trends are that internet and social media, patients are informing themselves and also connecting with their relatives. They might be maids in Italy, but they have a lot of information. Okay? And they are making their own decisions beyond the opinions of their local doctors and the FDA. They are taking control and responsibility for their own health. And if you deny them that right, they will simply travel abroad. Okay. So be careful about this, oh, let's ban it and let's prohibit it type of US FDA mentality. Okay. You cannot read this, unfortunately, but the issues are beyond scientific, the medical applications, and I will talk more about the dangers of embryonic, aborted fetal, and genetically modified stem cells. You know, I work with these cells in the US. I work with embryonic stem cells that is derived from our pre-implantation genetic diagnosis without destruction of the embryo. So there is no religious ethical issue. Okay. And I work with induced pluripotent stem cells myself in the laboratory. How do I confirm that they contain stem cells? I inject them into immunosuppressed mice. I know they have stem cells that are pluripotent when they form tumors. Why would I inject them into people? Okay. The legal and economic issues are overshadowing scientific data and health regulations. Let me just give you some examples. This is part of this was presented at our forum in the Center for International Law in Austria. But stem cell patents in the US, Europe, and South America, Asia, is affecting regulatory law, the economics of healthcare, business competition, science funding, and the conduct of clinical trials. Where does the Philippines stand in all this? Human cell patents are dominated by the United States, the UK, Germany, and Japan. I'm just going to quickly trace what happened, which we reviewed among the European Union lawyers. The European Parliament, back in 1988, issued a directive banning patents on human embryos for industrial or commercial uses. But this created a big deal of controversy, and each country in the European Union had its own policy, with Germany on one side of the fence. In collaboration with the US and the UK, they granted a patent on human stem cells in Germany under Büstle, an investigator who was collaborating with Americans and British scientists. And in the UK, a patent was awarded to Geron, a US corporation. Following their US patent, they applied for a patent in Europe by using Germany as being the side door. They were awarded a patent on the use of embryonic stem cells to be able to treat neurological diseases. Okay, so, there are, by the way, we have a big database of US patents. That's part of my work. There are a lot of these patents. And what the consequence of that is that you cannot use any of these products without paying royalties to the United States. So what happened was that Greenpeace started protesting. And at the time, University of Edinburgh was also granted a patent on human embryonic stem cells. Is that, in fact, it was broader because it affected also patentability of even the processing of adult stem cells. And the dispute continued in the European Patent Office and in the Federal Patent Court of Germany, and it went up finally to the German Bundestag. And at this time, both sides of the issue were already going into highly emotional terms, accusing each other of fraud and deception. Okay. And in the meantime, France entered into the picture. and protested the German patents in the European Union. And in the European Parliament, it swayed towards the non-recognition of these patents. Finally, the European Patent Office stated that the cells that were patented by Germany and in the UK were not valid. Okay. Now all hell broke loose because now people were fighting in the courts, filing lawsuits against each other, against the University of Edinburgh. University of Edinburgh filed lawsuits against Greenpeace, and the French conservative group started filing patents against the German patent office. Okay. Finally, it reached up I have difficulty advancing this. To the European Court of Justice, the Supreme Court of the European Union. Let me just tell you the final decision. All of these patents were invalidated. Okay, so under the European Court of Justice, all throughout the European Union, none of the US patents, none of the German patents, and none of the UK patents were honored. Okay. And the rationale was one of human dignity, not based on patent law. Okay. And the end result of this, because of the lack of now protection of these patents, of these commercial companies, the original holder of the patent, Geron Corporation in California, that conducted the first clinical trial that was approved by the US FDA, stopped their program, supposedly for lack of funding, but it was really because they all of a sudden realized that they cannot prevent people from using these technologies without paying royalties to them. Okay. So the clinical trials involved in the uses of these cells, including for heart ailments, diabetes, and other diseases, all of a sudden went to a screeching halt because of patent law. Does that give you a suspicion that maybe commercial companies are basing their work and their clinical trials at the universities because of monopolies in the uses of these cells? If they cannot patent it, they are not going to work on it, and they are not going to conduct clinical trials on it, and they are not going to publish the clinical trials on it. And this is what we here are waiting for, are the published clinical trials, which are really driven by profit and patentability and monopoly of these practices. Are they going to conduct clinical trials on your own cells, on autologous bone marrow cells? Are they going to promote the uses of umbilical cord for these treatments? They cannot patent it. They are not going to control it. They are not going to monopolize it. They are not going to do it. Okay. Does that mean that they don't work? They do work. The safety is established. The efficacy is established. But do not hide behind this evidence, EBD, the evidence-based constructs, to think that that is where science comes from. Doing meta-analysis on published US studies is not science. Okay? What is behind it is money put up by pharmaceutical companies and organizations involved in stem cells to be able to control the technology. Okay. If they cannot control it, it's not going to be sponsored by them. In the meantime, the power of the healing capacity of these cells is left ignored. Okay. We should not here in the Philippines, and particularly with the Philippine FDA, fall into that trap. What is happening in the meantime in other parts of the world, not just in Europe, but in Mercosur, the Mercado del Sur, composed of Venezuela, Argentina, Brazil, and Venezuela, decided not to honor the US patents on cells. China is giving it lip service but is not honoring it. India is ignoring it. Okay. So whereas the other countries in the world are already getting wise to the strategy of the advanced countries like the US, the UK, and Germany, other countries are refusing to adopt it, to accept it. Here in the Philippines, we have to be careful about following American practices in the US Patent Office and the US FDA. Okay. We have to develop our own to protect our own interests because, let me assure you, as a US citizen, the US is not going to protect your interest. You have to fight for it. Now, let me go further back then. What is behind the uses of these stem cells? They were described a long time ago. Tiempo pa ni Rizal. Literally, tiempo talaga ni Rizal. Okay. Because by themselves, they do not work. Many other components needed, but it was recognized by Rudolf Virchow in Berlin in 1858. When he studied cancers and aborted fetuses, that there were embryo-like cells in cancer in normal tissues. But you might ask yourself, if it was already described and found many years ago, why was it not adopted for human use? Dr. Rudolf Virchow was a scientist, a physician, a pathologist. He was a politician. He was a member of the Bundestag and a friend of Jose Rizal and Ferdinand Blumentritt, okay, who himself, Dr. Rudolf Virchow himself, was being attacked and his life was threatened because of these ideas. Okay. What happened in the meantime, however, at around the same time, also in Germany, a dye salesman by the name of Bayer, who was selling commercial dyes to dye textiles, got Westcott to manufacture synthetic dyes in the laboratory. Instead, at that time, we were using vegetable extracts to dye textiles. Westcott, funded by Bayer, started to make synthetic dyes that we now know many of them are cancer-causing. This is basically the origin of the drug industry. Because later on, Duisberg and Hoffman developed aspirin, which was patented. It would never have been commercially developed if they could not patent it. And it was sold all over the world, particularly to soldiers in the battlefield, where even if they're tired, their knees are painful, you give them aspirin and they can fight again. Okay. And people started taking them, and the doctors wanted to go ahead and give them aspirin and call me in the morning. What does aspirin do in arthritis? Does it solve the root of the problem? All it does is mask the symptoms. And then we got so sold into mass-produced pharmaceuticals that Bayer is still a billion, including aspirin, $1 billion sales a year. With growth in these mass-manufactured chemicals that do not address the root of the problem, okay, continuing to be sold worldwide. In the meantime, the uses of cell therapy went to the wayside, even though it actually preceded developments in the drug industry. Cell and cell therapy was already being described by scientists. Okay. But unlike drugs, you cannot mass produce this. You cannot one size fits all this. And it doesn't work like drugs because the effect does not appear within days. It appears many months later but it really addresses the root of the problem. Adult and umbilical cord already established in safety and efficacy. 1959 bone marrow transplant, okay, used for the treatment of leukemia, but established to be able to repopulate the bone marrow, and then it had been used for diseases other than cancer. The applications to cancer is not new either. That's been there since 1968 in University of Minnesota, still a leader in these applications. They were already used in a immunodeficiency, aplastic anemia, sickle cell disease, thalassemia, and autoimmune diseases such as lupus and many inborn genetic defects. Stem cell applications at Johns Hopkins. George Santos to create the stem cell regimen, who was my mentor at Johns Hopkins, and beyond, hundreds of thousands of these patients already been treated worldwide. Okay. Established safety and efficacy. It is not under FDA regulation because it is not a drug, nor is it a device. But its use is established. Again, bone marrow and umbilical cord. And not just for leukemia, for many degenerative diseases, including autoimmune diseases. The pharmaceutical company would like you to believe that they are the only ones who really have solid data. What do they have to show? Steroids. Steroids for the treatment of autoimmune diseases like lupus and rheumatoid arthritis. What do steroids do? They depress the entire immune system. Does it address the root of the problem? Absolutely not. Do you think steroids are so safe? A lot of deaths are caused by the drugs, not by the disease. Okay. So you put this in perspective, put it in context. Okay. But who is going to patent your own cells to treat lupus? Who is going to force you to pay royalties to Abbott for using your own cells to treat these diseases? That is what is behind this. And they have been so successful in convincing the physicians that their data is the only one worth paying attention to because of randomized clinical trials and multi-institutional trials to look at benefit. Like in cancer, for Alimta in lung cancer, what is the benefit of standard of care US FDA approved Alimta in lung cancer? I wrote a book about this. Okay. Really marginal benefit. It's US FDA approved. But it gives profit of billions, $3 billion a year. Does it really benefit patients? No. Okay. But may data kasi of randomized clinical trial. Okay. All right. So be careful of this. Okay? Because the factors affecting our health practices are not science. It is really politics and economics. By the way, I said the same thing in our international conference of chemotherapy. I don't think anyone really protested. They may have been grumbling in the background, and many of the people there in the pharmaceutical companies were there, but what are they going to say? That this is wrong data? I mean, they can look at the data themselves. Okay. Let's take a look at the media. Okay. The famous scientific journals like Time and Newsweek. Okay. How the coming revolution in stem cells could save your life. Time magazine. Save your life. Not just in cancer, but diabetes, heart disease, and Parkinson's. And then they quoted Harvard, my alma mater. Embarrassed me because the focus was on embryonic stem cells. If we already know that embryonic stem cells can cause cancer, and embryonic stem cells will induce rejection, why is this being promoted? Because of patents. induced pluripotent stem cells. Genetic transfer of 4 genes that I happen to work with that cause cancer, but it is patented. Okay. And some of our physicians here who read the internet say, oh, okay naman yan ang induced pluripotent stem cells because it's being promoted, approved on clinical trials. Okay. How many of these people making statements like this actually work with these cells? Okay, so be careful about getting experts to work with you in the FDA who actually don't really have direct experience. I work with these cells. I inject them into mice. They form cancer. Okay, so when you have an expert working with you, ask them what their direct experience is. Because reading about it on the internet does not give you expertise. Ito pa, The Economist. Cancer and stem cells. Well, these are their lessons. The reason why it's in The Economist is because it has been thought or estimated that the uses of stem cells will alter the balance of economies because these are trillions of dollars involved. But their lessons are, this was by the way in 2011. 2011. Kasi mga breakthroughs ito. Molecular markers of stem cells used to identify a small population within cancer responsible for the failure of chemotherapy and radiotherapy. Okay. Kasi breakthrough daw ito na information. Okay. Well, for the most part, we are not really able to alter the survival of cancers. You know, may mga improvement which then the National Cancer Institute in Washington, D.C. publicizes. But the improvements in survival is really marginal. Patients are still dying, right and left, but a lot more toxic than they used to be. This is what I teach is chemotherapy. And, you know, this is why we had to develop other approaches because chemotherapy is pretty sad. Okay? Because of the emergence of drug resistance. But identifying the stem cell-like cancer cells is the key to molecular targeting and personalized medicine because you cannot treat breast cancer patients in the same way. Why do you have these standard drugs for breast cancer? It is really a delusion. And the pharmaceutical companies want you to prescribe them in all patients, even though 60 to 70% of them are already resistant from the very start. Why are we allowing this practice? Because it's approved by the US FDA. And molecular profiling to recognize the uniqueness of each patient is the key, the key to success of treatment. And the one-size-fits-all approach does not work. Okay? 2011. This is a book I published 15 years before in Switzerland. Drug resistance develops quickly in tumors treated with chemotherapy alone. Sounds familiar? Specific genes related to stem cells greatly influence resistance to chemotherapy. Sounds familiar? To overcome drug resistance, you need multiple modalities, including immune stem cells, to be able to overcome drug resistance. And I taught this subject here in the Philippines back in 1979, not in 2011. Who are the people who refuse to accept this? The medical oncologists. Kasi chemo ng chemo, napaulit-ulit ng chemo. Okay. Resistant na to chemotherapy, chemo pa rin ng chemo. Okay. Because the problem is they cannot do anything else. They just prescribe chemo. Yes, it's okay to use chemo, but you better personalize it to each patient. Okay. And stem cells can be used to overcome drug resistance. Buhay ito ng pasyente. Why are you giving them drugs that are so toxic? But we have the ways to be able to identify the mechanisms of resistance. Not in 2011, but 15 years before. Okay. This is part of my frustration of coming here to the Philippines, is because, I usually have to quote foreign sources in order to get physicians to listen. Because ang attitude nila ay Pilipino lang naman yan. Okay. All right. Let me go forward, and because a lot of this was already reviewed, let me just tell you about the setup that we use to be able to personalize. This is, I hope that communicates why we have an Institute of Personalized Molecular Medicine and not a stem cell program. And why this is not so easy to do? Because aside from stem cells, you need three-dimensional scaffolding, you need epigenetic and genetic modifications, and look at their expression. You need extracellular matrix proteins, anchoring intercellular proteins. You need intracellular proteins, including intermediate filaments, microfilaments, and microtubules. You have to be aware of all of those. You need protein growth factors and protein differentiation factors, and you need electrical energy and signaling. How can you do this on the second floor of a McDonald's or in a mall? Okay, let me go forward. Sorry. Okay. Now, I talked to you a little bit about bone marrow. Let me tell you about umbilical cord. Okay. I have been using umbilical cord stem cells for more than 25 years. The safety is very established, and they are very strong cells. But aside from umbilical cord blood, which is what these banks, commercial banks, do, there are many other stem cells other than umbilical cord blood. Because umbilical cord blood is mainly used for blood diseases. But the substance of the cord, the Wharton's jelly, is a source for mesenchymal cells that we can induce to become cardiac muscle, skeletal muscle, liver cells, kidney cells, cartilage, and bone. And they have stromal cells that can differentiate into nerve, brain neurons, glial cells, and even epithelial and epidermal precursors. We are able to produce blood vessel-forming cells from the substance of the cord, not from the umbilical cord blood. Here at the medical city, we have been collecting all of these cells way beyond umbilical cord blood. And no, we do not have to send it to Singapore. In fact, the technology here in the Philippines is more advanced. Okay? And we have both a private and a public bank. So that matching, if in case the cell type is matched, it can be used for a recipient who is unrelated, who did not pay for it. Okay? Is that clear? The disadvantage of umbilical cord blood is that it is not just a question of putting it in the freezer and then you are going to thaw it, because the number of cells that I need to treat a patient, I do not just work with this in the laboratory. I am an end user of these cells. The patients will wind up going to me. If I get a matched umbilical cord and the patient is 15 years old or older, I cannot use it. It's not enough. Ang number of cells doon is so few in number that if I give high-dose chemotherapy and the number of cells is not adequate, my patient will die. This is not a question of my patient might die. Okay? The patient, my patient, will die. Ako ang sasagot niyan. This is why I will not accept umbilical cord blood from foreign banks. Okay. I am not just working in the laboratory. Ako ang naghaharap dito sa mga patients. Okay. I will not accept it. So do not be misled into thinking, ay kasi may umbilical cord blood doon na oh, it's okay to use it. It is very difficult and the number of cells there are not adequate. Because what will happen to the patient if the cells do not engraft? The patient will die of infection, it will die of bleeding. Have I seen this? Yes, many, many times. And I just imagine facing the parents of a child who is bleeding to death. That is the issue we face. Okay. And no, you cannot just, oh, put it in the freezer and then hope that something good will happen. Well, it is a lot more complicated than that. When I presented some of this information before, including among lawyers in the European Union, they said, well, Dr. Bernal, yes, it makes sense because that's a theoretical possibility, but that's just the danger of these other cells, ang mga embryonic and aborted fetus and mga genetically altered. Yeah, that is a theoretical possibility, but there are really no reports about cancer developing. Wrong. There are a lot of reports. This is just one recent example. Okay. This is a patient from Israel who went to the Ukraine. By the way, a lot of Filipinos are going to the Ukraine, to Germany, to China, into India for embryonic stem cells. What are you going to do? You are going to prohibit it in the Philippines. They are going to just travel anyway. What are you going to do? Confiscate their passport so that they cannot leave the airport? You have to offer them safe and ethical alternatives here in the Philippines. Okay. This is a patient who was treated in the Ukraine for a neurological disorder, treated with aborted fetus. By the way, some of these aborted fetal cells are already coming to the Philippines from China, where abortion is an industry. Okay. That's what the US FDA needs to focus on. Yung talagang unsafe na mga practices. Yung embryonic, aborted fetus, genetically altered, yung binabiopsy daw sa hotel, sa EDSA Shangri-La. Kumukuha daw ng skin cells from the singit, dinadala sa Germany, ibalik dito, i-inject. Okay? These are the things you have to focus on. Forget about the beauty treatments because, people are not gonna die from that. By the way, the beauty treatments are, yes, it's increasing in number and people are using all sorts of cells as long as they're safe. That's not where the focus should be. But you have a major battle facing the applications of embryonic, aborted fetus, and genetically altered. And then the fourth, which is animal cells, I'll talk about in a little while. Okay. But this is already established that not only is the cancer-causing potential simply a potential, but patients are already dying from cancers, from people who inject these cells into people. Have I ever heard of someone who developed cancer from being injected their autologous adult cells? How many patients have been treated? Hundreds of thousands. Has that ever happened? If there are these ethical and safe sources of cells, why are we paying attention to these others? Because of patents and greed. The same thing, by the way, with itong induced pluripotent, Congratulations to Yamanaka for winning the Nobel Prize this year for itong induced pluripotent stem cells from skin. He just issued a statement that he would never inject this into patients. But there are Germans coming here to the Philippines talking about induced pluripotent stem cells being used on Filipino patients. That's what the FDA needs to pay attention to. Let's take a look at animal cells. So many patients, someone who asked the question about our prominent people going to receive these animal cells? Oh, you did. Okay, can I add to the comment? Okay. This is not a topic for discussion in the US and in Europe because that matter has been solved many years ago with our meeting of the American lawyers, including those who testify for the FDA and for US Congress. And in Europe, under the European Union, this is not a topic for discussion because this is already settled. Okay? It is very dangerous and should never be allowed. Because they can cause itong mga sheep cells from Switzerland that was originated by Nihans in the 1930s in Switzerland. Switzerland already banned this. So lumipat sila sa Germany, where it was also banned in Germany, but nagkaroon ng lawsuits against the Ministry of Health, so they justified it on the basis of being grandfathered. Since it was grandfathered, hindi rin inapproved. It's not that it is approved, that is not correct. It is just does not require a license because it had been used since the 1930s. But in Switzerland, I'll explain why, it is illegal. In the United States, if you are caught bringing these things through customs, you will go to jail. And the doctors who applied them before in the US were put in jail. Not a topic for discussion anymore. Okay. In other countries. Okay. Because they can cause fatal complications, serious immunological reactions, fatal gas gangrene, polyradiculitis, leukoencephalitis, which is very painful, fevers to 40 degrees, okay, and death. Guillain-Barré syndrome, which is the demyelinating disease leading to paralysis and death. Immune complex vasculitis, encephalopathy. Am I surprised? You know, Dr. Faundo already mentioned it. Even if I take your sister or your brother, pareho ang parents ninyo, and I assume you are human, maski i-injectionan ko yun na walang compatibility testing, you could die. What more for sheep or calf? Ngayon, itong sa ASEAN Law Association namin, we have meetings with lawyers. We have meetings with lawyers in Indonesia and Malaysia. They are also there selling rabbit cells naman. Kasi ano daw ito pure daw bred rabbits. I don't care if it is calf or rabbit or sheep, it is still hayop, it doesn't belong in your body. Plus, merong jagseed virus in sheep. Merong brucellosis. Merong encephalomyelitis virus that could affect humans. You know how AIDS started, right? From jumping into animals. How did SARS started? From the civet. Itong mga leptospirosis natin, puro animal-based yan, and you are going to, it's bad enough to go to a farm, you are risking infection. I-injectionan mo pa sa sarili mo? What is wrong with our public officials? Now, let's backtrack a little bit. If I am a greedy businessman, who would I approach first to be able to get the FDA off my back? Members of the Senate and members of Congress, right? Lalo na through their wives. Yan ang awayin ninyo ngayon. Bahala kayo dyan. Ako aalis, ako papuntang Europe. Okay? I'm just telling you what your responsibility is. Okay? This is not my responsibility. I'm an American citizen. Okay? Okay. Good job for the FDA. Okay? So, good luck. Okay. These are some of the references that I will provide you at the FDA. Actually, Dr. Ona has a copy of these. The actual references. Alpha here, by the way, is one of our assistants who is involved in technology transfer. Those of you who are interested in getting some of these references can just talk to her and she will either email it to you or give you a CD or any other information that we can provide. That's the best. How to arm our patients. It's not just regulation. Yes, regulation is important, but we have to arm the general public with information. Because this is testimony in the US Congress on cellular treatment, describing these complications. Germany, about the deaths in receiving these animal cells. From the Cancer Journal of Clinicians, And some of the court cases that appeared in the US and in Scotland and in Switzerland about the uses of these cells. Okay. I was shocked to know that this is still a topic for discussion here in the Philippines. Because these companies, when they cannot sell it in their home countries, and they are banned in Switzerland, they cannot sell it in England, they are totally illegal in Ireland and Scotland, and it is a criminal offense in the United States. Naghahanap na yun sila ng bansa na maloko nila ang mga tao. Okay? So if you are going to want some of these cells for beauty, a number of general rules, better your own. How can you go wrong with your own? Eh sabi nila daw, itong mga ship cells na ito, bata eh. Ako 40 years old na ako, hindi ba matanda na yon? No, because we have isolated even from 90-year-old patients, as long as you get it from the bone marrow, we can still grow your young cells and stimulate them to be able to induce tissue repair. So don't despair. Just because you are, how many 90-year-olds are here? Okay. Just because you are 90 years old doesn't mean that it is too late. Okay? We get some of those patients. What shocks me, meron kaming mga 26-year-old patients na nagpupunta. Anong problema mo? Eh, may shooting ako next week. Eh, ngayon, tingnan mo yung aking mukha. Natutulog ka ba? 2 hours lang. Naninigarilyo ka ba? Eh, 1 pack lang naman a day. Okay. You think you're gonna look pretty with that? Okay. So, there are a lot of things you can do for beauty. You know, I realized dito sa Philippines about how vain the Filipinos really are. I live in the Czech Republic. You know, ang mga Czech Republic, halos lahat dun mukhang Miss Universe. They're not aware. They are not aware that they look like Miss Universe. Kasi, yung mga waitress nila, pati yung mga basurero nila dun, mas gwapo pa kaysa kay Piolo Pascual. I mean, but they are not so aware of it. Ang mga Filipino, nako. Okay, so, fine. But if you want the cells for beauty, you might as well use your own. Okay? Wag hayop. Okay? Anyway, that's just wrong. Okay? But let me make a final comment about other cells that some of our prominent people also receive. Kasi ni Mina Market, itong mga cells daw in a vial, you know, that Dr. Faundo already mentioned. You know, when we put cells in a vial, it only lasts a few minutes in the absence of oxygen before it will die. How can you promote this na merong beauty treatment daw? Saan ang galing? Ay, in-import daw ito. In what? In a vial. Sabi ni Herman Moreno, hindi ba namamatay yan? Hindi, it's well sealed daw. These cells are alive. How would you like it if I put your brain cells in a vial? How long do you think it will survive? Okay? And another type of cells na pinopromote, ito daw yung one of your prominent people went to Tagaytay daw to receive stem cells. Ano daw itong klaseng stem cells? Ay magaling daw ito kasi safe talaga. Plant. How many people here are in the Department of Agriculture? I am a consultant, by the way, for the Department of Agriculture. We train some of their scientists. Yes, hindi ba? May stem cells naman talaga ang plant. Okay? But it will not work on you unless you are a potato. Okay? But I'm not denying that some of our politicians are potatoes. Maybe some of them are. I don't know. I mean, okay. All right, I'm going to stop there and maybe open for questions. I'm sure you have a lot of questions. Thank you.